In collaboration with the Federal Ministry of Health, has already...
As you of course already know, WHO Director General Dr. Tedros Adhanom Ghebreyesus has reconvened an emergency committee under the international health regulations on the Ebola virus disease in the Democratic Republic of Congo. The committee will ascertain whether the outbreak constitutes a public health emergency of international concern, obviously, and what recommendations should be made to manage the outbreak in case. This will be the third meeting of the committee on this outbreak. The first one was on 17 October and the second last year, and the second one on 12 April. On 11 June, the Ugandan Ministry of Health confirmed a case of Ebola in Uganda. The patient, a 5-year-old from the Democratic Republic of Congo, has since died. The grandmother, so this death was on 12 June in the morning, I think. The grandmother, the 50-year-old grandmother of that little boy also died the same day, so this makes 2 deceased cases in that cluster. A third confirmed case, the 3-year-old brother of that little boy, has been repatriated voluntarily, and that's important, on their own wish, to DRC from Uganda with parts of the family in order to receive treatment at the Ebola treatment center in Beni. Uganda does have experience in managing Ebola for quite a while. The country has been preparing extensively, as you just stated, also over the past month for potential cases. The Ministry of Health also responded quickly on this situation with rapid sharing of information between the health authorities, the health workers recognizing Ebola symptoms in the patients and quickly providing them with the health care. So preparedness and early action are very vital in to contain an outbreak early, as you all know.
Attacks on healthcare and 5 health workers injured. WHO, in collaboration
We are a hospital. It is a general district hospital in the Congolese district. The only referral hospital in the Congolese district as a government. And there are other hospitals like Kilembe or Kagando, but this place was specifically selected to manage any outbreak that would happen in Kasese. When this epidemic came, of course, nobody could predict that it's happening. It came while other patients were there. And fortunately enough, the skills we had, we managed to discover that these were suspects, and immediately we had to isolate them. Isolation is the best method of protecting other patients from getting diseases, or nosocomial diseases. we may need a physician, and you find that we don't have a physician, but we hope we shall get one. You will find that all the supplies may not be adequate enough to our patients. We have a lot of patients here, so the drugs may not be enough for our patients here. Then even space, for example, as I talk now, the isolation for epidemic patients is not adequate.
But I think we need another battery. That one could be